Good morning, everyone. Today we will be continuing your module number 3. We're now in section 4 with keyword House Tyrell dash 451. So let's continue. Number 61. A client with spinal cord injury says he has difficulty recognizing symptoms of urinary tract infection or UTI before it's too late. Which of the following symptom is an early sign of UTI? Is it A, lower back pain, B, burning on urination, C, frequency of urination, or D, fever and change in clarity of urine? Now, if you go back to the situation, we're trying to find out which option is an early sign of UTI. The best answer in this question is letter D. Now, we will rationalize why it's letter D, but first, let's try to find out why the other options are wrong. A, lower back pain. This is wrong option because pain as a symptom is usually considered late. Remember that when you're trying to answer questions about early and late signs, remember that pain is most of the time, not always, most of the time a late sign. So if you're not sure about it, at least consider it as a late sign. Now letter B, burning on urination. Again, if we go back to the situation, the history of your client is spinal cord injury. When a client has spinal cord injury, there is of course what? Alteration in sensation. There's alteration in sensation. Therefore, it is less likely that the client will be able to feel burning. So eliminate B. Letter C, frequency of urination. Again, client has spinal cord injury and therefore will not be able to feel frequency of urination. That's why D is the best answer, because this is considered to be an early sign of urinary tract infection. Number 62. Client tells the nurse he boils his urinary catheter to keep them sterile. Which of the following questions should the nurse ask? A. What technique is used for catheterization? B. What temperature are the catheters boiled at? C. Why aren't pre-packed sterile catheters used? Or D. Are the catheters dry and stored in a clean, dry place? Now going back to the situation, we're trying to find out which question should be is the best way to ask when a client tells you that he or boils his catheter. The best answer here is letter A. Now let's go to the other option first. B. What temperature are the catheters boiled at? So eliminate B. Why? Because automatically you don't have to ask this, because water boils at 100 degrees centigrade, period. That's it. Okay, there's only one boiling point of water, and that is 100 degrees. So it's not it's irrelevant to ask the temperature. C. Why aren't pre-packed sterile catheters used? Eliminate letter C, because remember that as long as the client is able to sterilize his catheter well, there is actually no need for a pre-packed sterile catheters, and this will just add additional cost to the client. D. Are the catheters dried and stored in a clean, dry place? Now don't forget that catheters are boiled just before it is used. Therefore, it's irrelevant, or it's nonsense to boil the catheter and then keep it in a dry place, because you only boil that catheter just before you use it. So it's irrelevant for D to be asked. That's why the best answer is letter A. Now, why do you need to ask the technique? Because this asking for the technique will actually give you an idea if the client is performing the technique right. This is to make sure that the client is able to maintain sterility. Because even if you're sterilizing the catheter, but the technique you're using during catheterization is wrong, you are still at risk for urinary tract infection. Next, number 63. A 60-year-old client had a colostomy 4 days ago due to a rectal cancer and is having trouble adjusting to it. Which of the following condition is most common? A. Anxiety. B. Low self-esteem. C. Alteration in comfort, or D. Alteration in body image. The answer in this particular question is letter D. Alteration in body image. Now let's go to the other option first. Remember that your client has a newly created colostomy. It was just created 4 days ago. And client is having trouble adjusting to it. But the question is, which of the following is most common? Okay. First, let's try to eliminate anxiety, because anxiety is common not after but prior the creation of your colostomy. Okay? Remember that creating colostomy is a form of surgery, and anxiety is common before surgery. Next, B. Low self-esteem is wrong, because although may be there may be low self-esteem due to the colostomy, but this is just a secondary reaction or effect to the client. It is actually an effect of letter D. So letter D first before low self-esteem. Remember that. And alteration in comfort, eliminate. Why? Because prior surgery, there is high discomfort from the client because of the rectal cancer. This is the reason why they created the colostomy, because of the discomfort. Now, after surgery, since there is now a colostomy, client is expected to feel less discomfort. Therefore, it doesn't make sense why after surgery, there is now an alteration in comfort. Actually, there should be less. So, it's not common after colostomy creation to have alteration in comfort. Therefore, the answer best is letter D. Alteration of body image. Because now the client has now a colostomy in his abdomen. Next. Number 64. Client or a nurse approaches a client with a recent colostomy for a routine assessment and finds him tearful. Which of the following action is appropriate? A. State he'll come back another time. B. Ask the client if he's having pain or discomfort. C. Tell the client she needs to perform an assessment. Or D. Sit down with the client and ask if he's like to talk about anything. So in this situation, we're trying to find a proper therapeutic communication to the client. The best answer here is letter D. Let's go to the other option first. Look at A. State she'll come back another time. This is wrong, because in this option, the nurse is ignoring the client. Letter B. Ask the client if he's having pain or discomfort. Eliminate B, because in this option, the nurse is asking or using close-ended questions. And close-ended question will not facilitate verbalization of feelings. C. Tell the client she needs to perform an assessment is the same with letter A. It's a form of ignoring your client. Therefore, the best answer is letter D, because of all this option, this is the only option that will promotes verbalization of feelings. Therefore, the best answer here is Dallas. Next, number 65. After a review of colostomy care, a client says she doesn't know if she'll be able to care for herself at home without any help. Which of the following nursing intervention is most appropriate to ensure continuity of care? A. Review care the client again. B. Provide written instruction for the client. C. Ask the client if there's anyone who can help. Or D. Arrange for home health care visit the client. So, in this situation, we're looking for the best option that will ensure continuity of care. And best answer here is Dallas. Although the other options like A, B, C, and D are good, are positive, they are not the best option. Which one is the best? Letter D. This is the best way to ensure continuity of care. Number 66. A client is experiencing mild diarrhea through his colostomy. Which of the following instruction is correct? A. Eat prunes. B. Drink apple juice. C. Increase lettuce intake. Or D. Increase intake of bananas. So the client has diarrhea, and which instruction is correct? Best answer here is letter D. Now, why is diarrhea a concern in colostomy? Because, like we all know, diarrhea, the client's stool is loose, and loose can lead to leak. That's why it's a concern. Now, why the other options wrong? A and B, eliminate them both, because prunes and apple juice will actually increase or worsen the diarrhea. So it's not right to instruct your client to eat prunes and drink apple juice. Now look at C. Increased lettuce intake is wrong, because lettuce is high in fiber. And high in fiber means loose stool. So when a client has diarrhea, we want the stool, or we want to convert the loose stool into, this loose stool into what? Form. And the best in the option that can form a, or that can create a form stool is, or the bananas. That's why letter D is the best answer. Next. Number 67. A client reports a lot of gas in her colostomy bag. Which of the following instruction is best? A. Burp the bag. B. Eat less beans. C. Replace the bag. Or D. Put a tiny hole in the top of the bag. What's the best answer? Letter A. Burp the bag. Let's go to the other option first. Look at D. Put a tiny hole in the top of the bag is wrong. Let's eliminate that, because this will lead to leakage. So that's wrong. C. Replace the bag. Eliminate. This is not practical, and it is costly in part of the client. B. Eat less beans. Although beans will decrease gas formation, it is not the right answer, because it will not address the current problem. What's the current problem? Gas in the colostomy bag. That's the current problem. Therefore, the best answer here is letter A. You need to burp the bag. Number 68. Client at routine blood glucose screening for diabetes mellitus tells a nurse she has excessive urination and excessive thirst. The nurse should ask about which of the following symptom first. A. Weakness. B. Weight loss. C. Vision change. Or D. Excessive hunger. Now, if we go back to the situation, we're looking for first symptoms related to diabetes mellitus. The answer here is DALS. Although weakness, weight loss, and vision change occurs with DM, they are usually what? Late signs. And excessive hunger, including your polydipsia, and of course your polyuria, these three are considered to be the hallmark. This is the hallmark signs of DM. When I say hallmark, they occur most of the time so to clients, or they are seen most of the time to clients who has diabetes mellitus, and they can be assessed at the early stage of your DM. So Dallas is the best answer. Number 69. Which of the following factors places a client at great risk for developing diabetes mellitus? A. Obesity. B. Japanese descent. C. A great grandparent with diabetes mellitus. Or D. Delivery of the neonate weighing more than 10 pounds. So we're looking for a risk factor for your diabetes mellitus. Best answer, letter A. Although these three are risk factors, the greatest risk factor is obesity. This is the greatest risk factor for your diabetes mellitus. Next, number 70. Which of the following blood glucose level is considered within normal limits? A. 70 to 125 mg per dl. B. 130 to 135 mg per dl. C. 135 to 140 mg per dl. Or D. 140 to 145 mg per dl. So we're looking for the normal value of glucose. The normal value for your blood glucose should be less than 126 mg per dl taken via fasting blood sugar. Therefore, the answer here is letter A. B, C, and D are all elevated and requires further assessment. Number 71. Client asks what diabetes mellitus does to the body over time. Which of the following condition is a common chronic complication of diabetes mellitus? A. Multiple sclerosis. B. Diabetic ketoacidosis. C. Cardiovascular disease. Or D. Hyperosmolar hyperglycemic non-ketotic syndrome. So if you go back to the situation, we're looking for a chronic complication of diabetes. Best answer here is Dallas. Now let's go to the other options. Letter A. Multiple sclerosis can be eliminated because this is not associated with your diabetes mellitus. Letter B. Diabetic ketoacidosis, eliminate. Although DKA is a complication of DM, but it is considered to be an acute complication. The same with letter D. This is also an acute complication. That's why you eliminate that. Best answer, Dallas. Remember that increase in glucose, which occur in DM, can increase the viscosity of your blood. And if there's viscosity of your blood, it can damage your blood vessels. Damage the blood vessels and eventually can cause cardiovascular disease. The most common cardiovascular disease related to DM is your atherosclerosis. Your can lead to actually to your coronary artery diseases. So the answer in number 71 is letter C. Number 72. Client asks how she may decrease the risk of developing diabetes mellitus, which runs in her family. Which of the following response is appropriate? A. Eat only poultry and fish. B. Omit carbohydrates from your diet. C. Start moderate exercise program. Or D. Check blood glucose level every month. In this situation, client is asking how to decrease diabetes. So we're looking for a primary prevention. Is it A? Eat only poultry and fish? No, that's wrong. The best answer in number 72 actually is letter C. Now, the other options are wrong, like A. Eating only poultry fish is an absolute word. It has an absolute word, and we all know that absolute are always wrong in this type of questions. So eliminate A. B. Omit carbohydrates is also absolute. Eliminate that. You do not omit carbohydrates. Instead, you need to select complex carbohydrates. You do not omit. you only select complex carbohydrates. These carbohydrates are the, those types of carbohydrates that are not easily digested. Therefore, glucose does not or glucose in the body is not elevated very fast because these carbs are hard to digest. Unlike candies and sodas, these are simple carbs. They are easily digested. Therefore, they have higher chance of causing hyperglycemia. And letter D, checking your blood glucose every month will not prevent development of TM. C is the answer. Start moderate exercise program. Now, moderate exercise program together with weight control. Weight control. This is actually the goal of primary prevention of diabetes. Therefore, letter C is the answer. Next, number 73. An 83-year-old client fractured a hip after a fall in her home. Because of her extensive cardiac history and chronic obstructive pulmonary disease, surgery is not an option. Client as a nurse, she doesn't know how she is going to get better. Which of the following response is best? A. You're doing fine. B. What's your biggest concern right now? C. Just give it some time and you'll be okay. Or D. You don't believe you're doing well? The answer in this number is letter B. What's your biggest concern right now? Now let's go to the other options. Letter A. You're doing fine is not the right option because there's no verbalization here. You are not asking the client to verbalize. Therefore, eliminate A. C. Just give it some time and you'll be okay is the same with letter A. There is no verbalization. And therefore, it must be eliminated. D. You don't believe you're doing well? Eliminate because this is not an effective form of asking the client to verbalize. Okay? This is simply asking your client to repeat his or her statement. Therefore, the best answer here, that the best option that will promote verbalization of feelings is letter B. Okay? Next, number 74. Client says she slept on a throw rug while going to the bathroom at night. Which of the following factors needs assessment? A. If the home is safe. B. If the client is confused. C. If the client hit her head. Or D. If the client has urinary tract infection. Now, if you go back to the question, we're asking which factor needs to be assessed. Now, assessment is a word. It's a word comprising of different ways, like your physical assessment, your vital signs, and so on and so forth. So assessment is a broad word. Okay. Therefore, when the question is asking which factor needs assessment, we're trying to find out. We're trying to assess a broad factor in this situation. We're not simply asking a question. Okay? Assessment is a broad word. It's not simply asking someone, are you hurt? Or something like that. Okay? Assessment is more than that. Now, the best answer here is letter A. Home, if the home is safe. Let's go to the other options. Eliminate D. Sleeping has nothing to do with urinary tract infection. So there's no association with the situation here. So eliminate D. Now, B. If the client is confused, eliminate. If the client is confused, the client wouldn't be able to make such questions. Okay? So obviously the client is not confused. Or letter C. If the client hit her head, if you want to find out if the client hit her head, just ask the client. Okay? Like I said, assessment is a broad word. It's not simply asking someone if he or she hits his head. It's more than that. Okay? Therefore, the factor that needs assessment here is letter A. Why do you need to assess if the home is safe? Okay, this is to prevent further sleeping. That's why you need to assess if the home is safe. Next, number 75. A client in her third trimester of pregnancy is having contraction 5 minutes apart that began suddenly. The nurse identified that it's the client's 7 month. She admitted directly to the obstetric department. Which of the following intervention has priority? Letter A. Call the obstetrician. B. Time the contraction. C. Check fetal heart tone. Or D. Call the client's husband. The answer in this number is you need to check the fetal heart tone. The other options are wrong, like letter D. Call the husband. Okay? This is not a priority at this time. This is not a priority. Time the contraction, eliminate because it is already what? It's already given in the situation. It's already given in the situation. And letter A is not your priority because you will only call the obstetrician after fetal heart monitor is in place. So you need to place the client in monitoring first before notifying the doctor. The answer here is letter C. Next. Number 76. A young client with anorexia nervosa is being treated using family therapy. Which of the following description applies to anorexia nervosa according to the social theory of causation? Letter A. A repressed issue. B. A learned maladaptive behavior. C. A reaction related to poor school achievement. D. A sign of pain within the whole family system. The answer in this number is letter D. A sign of pain within the whole family system. Let's go to the other options. Letter A. A repressed issue. Eliminate because a repressed issue as a definition or a theory for anorexia is under psychoanalytical theory. Psychoanalytical theory. Anorexia, viewed as a learned maladaptive behavior, is under the theory of behavioral. So this is behavioral theory. So eliminate that. C. A reaction related to poor school achievement. Eliminate that because anorexia nervosa is usually what associated with high level school performance. So clients who have anorexia nervosa have a history of being an achiever. So letter C is wrong. Therefore, the answer is Dallas. A sign of pain within the whole family system is theory viewed under your social theory of causation. Letter D is the answer. Next, number 77. Which of the following diagnostic tests is performed first to detect transposition of great vessels? Is it A. Blood culture, B. Cardiac catheterization, C. Chest X-ray, or D. Echocardiogram? Answer here is letter C. Chest X-ray is the one that is being used first to detect transposition of great vessels. Eliminate A. Blood culture. This is not a diagnostic of your TGV. It will not tell you if the client has transposition of great vessels. While cardiac catheterization and echocardiogram can see transposition of great vessels, this is what? Invasive. That's why this is not the first. And echocardiogram is more expensive than a plain chest x-ray. That's why chest x-ray first is used, and if they find out that the client has transposition of great vessels, client may undergo cardiac catheterization to confirm the diagnosis. Best answer here is chest x-ray. Number 78. 4 6 months old children arrive in the clinic for DPT immunization. Which of the following children can safely receive the immunization at this time? Letter A, the child with temperature of 103 degree Fahrenheit. B, child with a runny nose. C, child taking prednisone. Or D, child with difficulty breathing after the last immunization. The answer in this number is Boston. Take note that a cold or sign symptom of cold is not a contraindication of immunization. So B is the answer. Now A is a contraindication. High grade fever is a contraindication of immunization. Eliminate C because immunosuppressed or clients with decreased immunity is a contraindication of immunization. Now you may ask why the client has decreased immunity. The client is on prednisone, which decreases immunity, and the client has leukemia, which also decreases your immunity. And letter D, the child with a difficulty breathing last immunization, eliminate because a history of reaction to the said medication will become a contraindication of that drug or immunization. Therefore, the answer here is Boston. Next, number 79. A nurse is giving discharge instruction to a parents of a child who has a tonsillectomy. Which of the following instruction is the most important? Letter A, child should drink extra milk. B, child should not drink from a straw. C, orange juice should be given to provide pain control. Or D, child's mouth should be rinsed with salt water to provide pain relief. The answer in this situation is Boston. Child should not drink from a straw. The reason why straw is not allowed or is prohibited to these clients is because the straw can disrupt the cloth at the operative site. So there's a cloth in the operative site placed by the doctor or the surgeon. You should not allow your child to use a straw because that straw can disrupt that clot. The other options are wrong because, like A, child should drink extra milk, eliminate because milk can increase mucus production, and it will increase mucus production and will cause aspiration in the part of the client. C, orange juice should be given to provide pain control, and using salt water as a pain relief can actually they can irritate the sites of surgery. Therefore, it must be eliminated. The best answer is Boston. Next, number 80. A 2-year-old child is diagnosed with bronchitis caused by respiratory syncytial virus or RSV. Family also includes an 8-year-old child. Which of the following statement is correct? Letter A, RSV isn't highly communicable. B, RSV isn't communicable to older children and adults. C, 2-year-old client must be admitted to the hospital for isolation. Or D, children should be separated to prevent spread of the infection. Answer, Boston. Remember that your RSV can easily be transmitted by toddlers. Okay? Toddlers easily transmit RSV. Therefore, there must be separated. Letter A is wrong. RSV isn't highly communicable. Wrong because it is highly communicable. Letter B is wrong because it can be communicated or transferred to adults. Letter C, 2-year-old children or client must be admitted to the hospital is not correct at this time because admission is only required if oxygenation or IV infusion is needed, but it was not mentioned in the situation that oxygen and IV is needed. Therefore, it's not important for the client to be admitted at this time. Answer here is Dallas. So that ends your section 4 of your module number 3. I hope you got very high in this test, and looking forward in rationalizing your section 5. Thank you and goodbye.